Hi, my name is Julie, and I am a nurse here in the Cancer Center. In this video, I will explain what you can expect for your systemic therapy appointments. You will be scheduled for a pre-treatment appointment to see your oncologist and nurse the day before your treatment. Some of your pre-treatment appointments may be scheduled the same day as your treatment. There may be other times where you may only see the systemic therapy nurse for these appointments. This is planned by your oncologist and decided by the treatment medications that you will receive. You need to check in at a computer using your health card when you arrive at the Cancer Center for every appointment. You need to do this even if you complete e-check-in on MyChart. E-check-in on MyChart allows you to complete the communicable disease screening and the Your Symptoms Matter questionnaires before you come to the Cancer Center. Complete the Your Symptoms Matter questionnaire before each of your pre-treatment appointments. This questionnaire allows you to tell us what symptoms are a problem for you. It asks you to rate 9 cancer-related symptoms on a scale of 0 to 10. 0 is when the symptom is not a problem for you, and 10 is when the symptom is a big problem for you. When you complete the questionnaire, your symptom scores are entered into your electronic health record. This allows your oncologist and nurse to review them before they see you. Having this information helps us plan the next steps in your care and treatment with you. This includes how to manage your symptoms. We may ask you about other symptoms as well. Take a seat in the waiting room after you check in for your pre-treatment appointment. A lab technician will call you for your blood work appointment. Systemic therapy treatments can affect your blood cell counts. Low blood cell counts may cause delays or changes in your treatment. It can take up to 1 hour for your blood to be tested and your oncologist to see the results in your chart. Your oncologist reviews the results of your blood work to make sure that it is safe for you to have your treatment. You will see a nurse for your pre-treatment appointments. The nurse will take your height and weight, check your vital signs, review the medications that you are taking. You can see your updated list of medications also on MyChart. They will also remind you to pick up the filled prescriptions for your pre-medications. They will review your symptom scores on the Your Symptoms Matter questionnaire and ask you about any other symptoms you may be having. They will also give you information on how to manage your symptoms and side effects of treatment. You will see your oncologist after seeing the nurse. Please bring a list of your questions or concerns to this appointment. You will notice that your systemic therapy nurses are wearing personal protective equipment throughout the chemotherapy suite. Your nursing team wears this personal protective equipment to protect themselves as they are giving many hazardous medications throughout the day to you and other patients. On the day of your treatment, it is very important that you take your pre-medications before your treatment as prescribed by your doctor. Take your regular medications unless your oncologist told you something different. Please drink 2 to 3 cups of fluid before your treatment. This is in addition to your morning cup of coffee or tea. This helps hydrate you before you come in for your treatment. We ask that you eat your regular meals, drink 6 to 8 cups of fluid on the day of your treatment and for 2 days after your treatment. This is a list of fluids you can drink other than water. Only 3 to 4 cups of your fluids should be caffeinated fluids such as coffee and tea. Plan to have someone drive you to and from your appointment. The treatment medications are new to you, and we don't know how they will make you feel. Bring the blue folder and the medication handouts that you were given. The nurse will answer any questions you may have. Bring any medications you need to take during your treatment. This includes medications you take for pain or other health problems that you may have. If you are a diabetic, it is very important for you to bring your glucometer. Bring snacks or a lunch with you. You may eat or drink in the systemic therapy suite. Your family member or partner in care must wear a mask at all times in the Cancer Center. They cannot remove their mask to eat or drink. Eating and drinking is only permitted in the hospital food court or outside of the hospital. Bring personal items such as a tablet or a phone with headphones or a book to read to help you pass the time. There are some TVs in the systemic therapy suite. Wear layers of clothing. This allows you to take off or add clothing if you need to. Pregnant women and children under the age of 18 cannot come into the systemic therapy suite. This is for their protection. Let us know if you have any questions about this. You need to check in at a computer using your health card when you arrive at the Cancer Center for your treatment appointments. Take a seat in the systemic therapy suite waiting room after you check in. We will always do our best to make sure you are seen on time for your treatment appointments. However, there may be delays if another patient requires more care than we expected. This may affect the time of your actual appointment. A volunteer or the receptionist can help you if you have any questions while you wait. A member of our team will call you from the waiting room and take you to a treatment chair in the systemic therapy suite. We will help you get comfortable in the treatment chair. You may sit in a different chair for each of your treatment appointments, and not every chair offers you access to a television. We give you a new armband to wear for each treatment. The nurses use this armband to verify your identity when giving you medications. We will show you where the bathrooms are. One family member or partner in care may stay with you during your treatment. Your family member or partner in care must use a bathroom located outside of the systemic therapy suite. A volunteer will provide you with a blanket at your first treatment. It is for you to keep. For your comfort, we suggest you bring this blanket with you to every treatment appointment, and our volunteers will also offer you coffee, tea, or juice. This is for you only and not for your family member or partner in care. During your treatment appointments, you may use your cell phone, but we ask that you to please keep it on silent or vibrate. Wi-Fi throughout the hospital is available for you to use. Do not wear any products with a scent or bring foods with a strong smell. Our hospital is a scent-free environment. You will be cared for by a team of nurses while you are in the systemic therapy suite. This means you may not have the same nurse for every appointment. A nurse will ask you if you have taken your pre-medications and tell you about the treatment medications you will be given. You will be connected to one of these pumps if your medication is given by intravenous. You may have other appointments scheduled in our Rapid Response Oncology Clinic to receive treatment medications or procedures that don't need to be given in the systemic therapy suite. The Rock Clinic is located on the B1 level of the Cancer Center. You need to check in at a computer on this level when you arrive for your Rock appointment. Please take a seat in the waiting room after you check in. We will call you from the waiting room when it is time for your appointment. Patients scheduled for radiation treatment appointments also use this waiting room. Please view and confirm your next appointments on MyChart after each of your systemic therapy treatment appointments. You will find more information about this in your Guide to the Durham Regional Cancer Center. We have given you a lot of information. It can be a lot to take in. Is there information you wanted but have not received yet? Please let us know if you have any questions or concerns about your cancer care or treatment.